It is not news to us that bipolar disorder has a devastating consequence on the society. Many a family has been affected from suicide, divorce, and disability that may have been precipitated by bipolar disorder. Patients of bipolar disorder do not die because of the direct effects of this disorder alone. They are prone to a host of associated problems like substance abuse, which contribute to a high mortality rate in this group of people. As per documented evidences, risk of substance abuse 11 times greater for patients with bipolar disorder. Substance abuse reported in 60% of bipolar patients, 46% of which is alcohol abuse. Substance abuse may greatly complicate treatment. A whopping 20% of bipolar disorder patients commit suicide. About half of bipolar disorder patients will attempt suicide at least once in their lifetime. If we compare the suicide rates between men and women, it is found that women attempt suicide much more frequently than men. Bipolar disorder also increases the likelihood of divorce by 3 times. The need of the hour is an effective and fast-acting medication. Even the experts agree on the same. Amongst the many options used in the management of bipolar disorder, Divalproex has been a prescriber's delight since the FDA approval in 1995. The experience of psychiatrists across the world over the last 12 years has only cemented the faith in depakote. Depakote, the Divalproex formulation, is a novelty par excellence. Following its launch in 2004, by June 2006, it has become one of the most preferred brands of Divalproex by psychiatrists. Let us see what depakote offers. Depakote has an early onset of anti-manic effects. It achieves accelerated therapeutic serum levels of Divalproex that leads to an early efficacy advantage over standard titration Divalproex, lithium, olanzapine or placebo. This effect of depakote, according to several studies, is due to the dosage being linearly related to the serum concentration of the drug. The therapeutic efficacy in the treatment of acute mania has been reported to be the best achieved at trough serum levels above 50 mg per ml. In large double-blind placebo-controlled trials of valproate concentrations greater than 50 mg per ml were obtained after 5 to 10 days. On the contrary, the desired serum concentration was achieved with depakote 20 mg per kg per day in 100% patients by one day itself. Another study showed similar effects in 84% of patients by day 3. What's more, depakote is also associated with a high degree of tolerability. In all the years of experience, depakote is not known to be associated with any major adverse effects. In a pooled analysis of 3 published studies of Divalproex 20 or 30 mg per kg per day versus standard titration, higher Divalproex serum concentration was found to be related to earlier efficacy in acute manic patients. Those patients who achieved a serum level of 80 mg per ml by day 3 were found to have statistically greater efficacy at days 3 and 5 than patients who did not achieve this level.